Hello, my name is Carly Minervini, and today I will be presenting my Literature Review Part 5. A clinical question in the PICO format is commonly used in evidence-based practice and includes the concepts of patient population, intervention or issue, comparison intervention, and outcome of interest. My PICO question is questioning if the use of sunlight exposure as a treatment for adults diagnosed with major depressive disorder improves and relieves their depression symptoms. Major depressive disorder, or more commonly known as depression, is a mental health disorder that is a prevalent problem that persists throughout the world. The symptoms of depression include morbidity, impaired cognitive function, decreased quality of life, decreased functional statuses, changes in sleep and appetite patterns, increased cost of healthcare services, and in severe instances, mortality. These symptoms have the potential to create long-term economic, behavioral, and physical problems. Depression can be challenging to treat as there may be a limited affordability of healthcare interventions, potentially is recurrent, and may be treatment resistant. Due to the barriers of finding effective and efficient treatments for depression, it is essential to research and find alternative interventions to aid in relieving depression symptoms and achieve a more cost-effective, readily available, and compatible treatment and care options. The purpose of the study is to identify the best and current evidence from peer-reviewed articles and scholarly journals that aid in proving a stronger understanding of the use of sunlight exposure as a treatment for adults diagnosed with major depressive disorder. The NCBI and Wiley Online Library databases were searched to identify relevant studies that contained information on the effects sunlight exposure has on depression and its symptoms. All studies were published within the past 5 years and are peer-reviewed from scholarly journals. The search was achieved from using the keywords of sunlight exposure, major depressive disorder, treatments and interventions, and depression symptoms. There are a variety of different treatment options available for major depressive disorder, which can include medication intervention and CBT therapy. These treatments can be very beneficial, but are exceedingly costly for the individual and the healthcare organization. Using sunlight exposure as a treatment for depression is a more cost-effective option for treatment, as there is no increased monetary cost to sit outside on a sunny day or go for a walk. Another advantage to using sunlight exposure as a treatment for major depressive disorder is that sunlight is shown to positively impact one's mental and physical health. Many physical ailments can worsen an individual's depression, so exposure to sunlight aids in increasing the endocrine, immune, and neurohumoral reactions in the body, which can decrease the symptoms caused by major depressive disorder. The main disadvantage reported in the research studies is that there are other treatment options that are either more frequently used or are more effective. Although sunlight exposure is an effective intervention for major depressive disorder and its symptoms, it is underutilized in most clinical settings. Currently, antidepressant medications such as SSRIs or SNRIs remain the standard initial treatment option. Medications and CBT therapy are the main treatments for major depressive disorder that individuals receive, as there are more clinical studies on these interventions, despite medication being more expensive and CBT therapy having mixed results. More research needs to be done on the quantifiable data of sunlight exposure on the symptoms of depression. While many studies conclude that the symptoms of depression are lessened by the use of sunlight exposure as a treatment, there is no quantifiable amount of therapeutic dose of sunlight in the systematic reviews. This lack of clinical data may be due to potential confounding factors such as the participant's lifestyle, genetics, and geographic location. The differences observed in the evidence indicate that every individual is different, and while the treatment is seen to be beneficial overall, there is no recommended level or amount of sunlight exposure that will work for everyone. 1 Corinthians 6:19 states, "What, know ye not that your body is the temple of the Holy Ghost, which is in you, which ye have of God, and ye are not your own? God created our bodies as a gift to be taken care of and utilized to bring Him glory, so it is essential to do what needs to be done in order to take care of the gift that God gave us. There are many different interventions for the treatment of major depressive disorder and its symptoms. While medication and CBT therapy may be the more popular line of treatment for clinicians, they can be more expensive with varying results. Research studies have identified the alternative treatment intervention of sunlight exposure as a viable option for the treatment of major depressive disorder. Using sunlight exposure as a treatment for major depressive disorder not only aids in increasing one's mental health status and decreasing depression symptoms, but also leads to the continued improvement of symptoms.